Hi, we are section 311 and our topic is compassion fatigue. My name is Ashley. What is compassion fatigue? Compassion is expressed as an act to alleviate the suffering of others, whereas compassion fatigue is experiencing negative feelings towards helping individuals feeling pain and suffering from traumatic events, thus, the gradual decline in compassion over time. As empathetic, caregiving individuals, nurses tend to absorb the traumatic events and stressors of their patients that they help and have expressed the concept of compassion fatigue as a unique form of burnout. Compassion fatigue occurs when health professionals individually internalize the trauma or pain of their patients, care for patients suffering for a long time without improvement, and work too many long shifts with a high workload. Which brings us to our next topic of effects of compassion fatigue.
My name is Whitney, and I'm discussing the effects of compassion fatigue. There can be many effects of compassion fatigue in nurses. Department related effects include decreased productivity, increased absenteeism, and an increase in employee turnover. As far as patient related effects, it has been reported that nurses suffering from compassion fatigue have a decrease in the nurse patient bond, a decrease in the ability to instill hope in their patients, and an increase in the technical aspects of the job as the patient care decreases.
My name is Aspen, and I will talk about warning signs of compassion fatigue. The continuing stress of meeting the often overwhelming needs of patients and families can result in what we know as compassion fatigue. It may be present in all clinical settings, whether it is in pediatrics, ICU, ER, psych, or even nursing homes. Nurses need to be aware of the signs and symptoms for themselves and their coworkers. They may experience feelings of failure, guilt, self doubt, sadness, anger, powerlessness, difficulty concentrating, emotional numbness, isolation and withdrawal, bottle up emotions, and even secretive addictions or self medicating in different ways. If you are feeling numb, crying, or losing sleep because of the people who you care for, you are experiencing compassion fatigue symptoms.
Hi, I am Demetria Jackson. And the next topic we will be discussing is compassion fatigue and palliative care nursing. Palliative care nursing are constantly observing the pain, trauma, and the suffering that patient experience due to factors of inner life care. The three major stressors that palliative care nursing come across are problems with their own belief, non complying with treatment, and nurse shortage. By alleviating these stressors, palliative nursing care improve physically, mentally, and emotionally. This will help increase patience in the care.
My name is Heather, and my topic is on COVID-19's contribution to critical care compassion fatigue. As coronavirus rages through the world's population, people are met with the perfect storm of uncertainty, anxiety, fear, depression, doubt, and the impossible task of having to push forward with life in our new normal. Essential healthcare workers, particularly those in the critical care field, have most often been pushed to their limits with compassion fatigue and burnout during their typical careers. The mounting number of people infected and dying with the virus only adds fuel to that fire. Healthcare workers are in direct contact with patients who have the worst cases of this virus. Not only are they stressed from the relentless tasks of caring for these patients, as we all figure out the virus's methodologies, but what does that mean in terms of carrying this virus to their home and possibly affect the ones that they love?
My name is Kayla, and I'm going to be discussing age-related factors contributing to compassion fatigue. Studies have shown that nurses who are older than 35 have showed more compassion satisfaction, whereas nurses who are younger that have worked less than 11 years, or new nurses that have no activity outside of work, have presented higher scores of burnout and compassion fatigue.
Hi, my name is Kendra Brady, and my topic is compassion fatigue relating to one's own trauma. Nurses can feel fatigued and sleepy and just plain worn out from all the long hours and all the hard work it takes to care for these patients. Some nurses often stated that they wanted to leave the profession of nursing because the stress related to their job. The stress associated with the overflow of work, especially associated at the height of COVID, this often caused some nurses to be sheltered, shielding themselves from emotional connections with patients and families.
Hi, I'm Janice, and my topic is how to reduce compassion fatigue and increase compassion satisfaction. Nursing settings that provide tranquility rooms as an environment where nurses can go to decompress or de-stress after stressful situations have shown to be beneficial. Facilities that offer reward recognition programs to show their appreciation for nurses and the hard work that they do, and having mentoring programs where nurses know they have a dedicated person that they can talk to help guide them through stressful situations have been beneficial in nursing. Overall, compassion fatigue can lead to stress, burnout, and nurses just wanting to give up the profession altogether. But when nurses have a positive outlet, such as yoga and other activities outside of nursing, they have been shown to be able to reduce the compassion fatigue.